Hello, I'm Alicja Baczyńska, and I'd like to welcome Marcin Radziwiłł, head of the Medicover Foundation, an organization which is currently running one of Europe's largest studies on type 2 diabetes among teenagers. The organizers behind the program, which is called PoZdro, seek to screen some 30,000 students for the condition over a period of 5 years. The program kickstarted in Gdynia last year, but before we start talking about the results of the study so far, let's talk about what type 2 diabetes is.
Thank you very much for the invitation to come in and talk about our program. The Medicover Foundation obviously saw the huge problem about today's situation among the Polish population, the world population, about the growing problem of obesity and people being overweight. So we created the PoZdro program to especially focus on the young kids who are also becoming more and more overweight and obese at an ever younger age. And diabetes type 2, which is a lifestyle-based disease, is a subsequent of a bad lifestyle, of being overweight and obese for too long. And if we don't exercise properly and we don't have the right diet, we can develop one of 14 various lifestyle-based diseases. And one of these is diabetes type 2. And this is what we're focusing on. We are... There is a slogan that one hears more and more often, that kids that are born after the year 2000 may live a shorter life than their parents because of the onset of lifestyle-based disease, i.e. diabetes type 2, at an ever early age. And it's a very frightening condition to be in. And this is why we've developed this program, and we're very passionate about bringing this across, making parents and children aware of the disease and what can be done to prevent it. And it's very simple. We have the solution in our hands. It's easy, and this is what we try and bring across.
Type 2 diabetes is reaching epidemic proportions, and people know the effects of sedentary lifestyle or poor diet and whatnot, and the health implications that follow. And yet, healthcare professionals alarm that the consumption of fruit and vegetables is on the decline in Poland. And research has shown that by the year 2030, there will be over 5 million diabetics in Poland and 3 million pre-diabetics. What's going on here? We are aware, but we're not doing anything.
Okay, well, firstly, the numbers that you've provided are still guesstimates. The problem can be on an even larger scale because there isn't an official register of people who have diabetes. However, the proportions of the disease are very frightening, and the consequences on an individual level are very bad. But also for society is also a huge burden. What's happening? Well, the consumption of fruit and vegetable is only one aspect. We have to look at the whole thing holistically. I would say it's a matter of awareness. Kids are not aware. We live in a society, as you say, a sedentary society, where we go from one sitting position to another. So we sit at home, we travel to school or to work in a sitting position, and we spend most of our day in a sitting position at school. So it's the sedentary lifestyle. It's the lack of, I would say, routines sometimes that people have. We all live in such a hurry. We don't have time to have a proper meal. So we snack, we use convenient foods, we use processed foods that are very high in fat, salt and sugar, which is a very, very it's a cocktail that is very pleasurable on one level, but it's not very healthy. They're empty calories. So, but it serves a purpose. But over the long term, you have to have a balanced intake of food, and because the parents are often working, they have two jobs. The kids come in on their own. They don't cook, so it all revolves around consuming the wrong food. So it's a complex number of factors that come together.
Mm-hmm. So let's talk about specific numbers. What are the results of the research so far?
Okay, just if I can, you've mentioned research. In fact, what our program is a very practical program. We are providing help to the young population, the 12 and 13-year-old kids going to first year of secondary school in Poland. And what it is, we work with local governments in large cities. The local government supports our program, and that gives us access to schools and to parents. We go into schools and we carry out a large screening program. It's free of charge, it's non-invasive, and it's completely we organize the whole thing. So we screen the kids. Once we've screened the kids, we know which kids are healthy and which kids are at risk of developing diabetes type 2 or other lifestyle-based diseases. And then we invite these children and their parents to a 2-year individual health coaching program where we meet very regularly. In the first year, it's 6 individual meetings with 4 specialists, a doctor, a dietitian, a physical activity specialist, and a psychologist. So we move as a family unit from one specialist to another, and we discuss our current health situation and health behaviors with these specialists. And they help us bit by bit to change the way we function as a family and as individual units. And out of that, we are gathering data, and of course we can then see what's happening. So to answer your question, we have so far in Gdynia screened around 2,500 children. Out of those 2,500 children, we have around 18% of kids who are overweight and obese, but I'm talking about serious levels of being overweight. And then out of those kids, we have around 22% who have joined our health coaching program, our intervention program. And then in Warsaw, we're still in the process of our first screening session, but we will have screened around 2,000 children by the end of this school year, and probably recruited around 300 kids into our health intervention or the health education or coaching program. And just to give you a rough, a few other statistics, we see that around, let me just check my notes so I give you the right information. We have, from a physical activity level, a fitness level, it's a very simple test. It's a step test where you walk up and down a step for 3 minutes. We have, out of the kids that we've tested, 20% of the children are physically fit, in good condition. The rest have a poor physical fitness level, or in fact sometimes we have to stop the test. And this is the equivalent of walking up 3 flights of stairs. And I remember as a kid we used to race the elevator and most of the kids were fit. Now we have a situation where 50% are completely unable to do this in an easy way. So it really raises big question marks. In Gdynia, we see that around 16% of the kids that we've tested out of the whole population have a increased blood pressure level. And then when we compare this to Warsaw, we have 35% of the kids that we test have increased blood pressure. These are 12 and 13-year-olds. So there's a lot to do, and it's in fact quite shocking that we're talking about this.
Yes, you've had the chance to talk to the parents of these kids.
Yes.
Apparently they were quite shocked with the results. Didn't they see it coming?
Well, it's sometimes if you're faced with something on an everyday basis, one doesn't always notice, or sometimes you don't want to really recognize that there is a problem. So people live in this bubble of denial, or in fact, you say to yourself, or the grandparents say, "Oh, isn't little Tom healthy? He's strong, or or he'll grow out of it. It's all puppy fat," and it's in fact something much more complex than that. So it's a matter of the stage you're at as a family to be open to things. And then on the other hand, there are more and more children that are overweight and obese, and it's the power of the group. If we're all like that, then you don't notice it. So I think it's a number of things. Right.
And is it easy to break through this bubble that you've mentioned? Is it easy to actually make those kids exercise self-restraint, determination, because it takes a lot of action on their part to recover, to become healthy again?
Yes. It's a process. This is why the health coaching program is comprehensive. So in the health coaching program, we've set aside 2 years to work with these kids. And it's not only working with the kids, but it's bringing the parents and the families in, because kids function in 2 systems, essentially, the school system and the family system. And it's very important to overlap and bring both worlds together so that we're the message is conveyed consistently from both sides. So that's one thing. Secondly is to provide support and do things in incremental small stages, and showing that small things can actually have a large effect. So replacing carbonated sweet drinks with water or with tea, and reducing days that you eat sweets on, and educating the grandparents that if we're doing something, we're going to live healthily as a family, then it shouldn't be sabotaged by the wider family who want the best for their kids, but they just show it in the wrong way. So and it's working on the children's and parents' awareness levels, and it's making some sort of agreement at each meeting about what can be changed and how it can be changed. Obviously, there are fallback where a plan hasn't worked, and then we analyze what can be done, and so it's constant work. On an individual level, we also have workshops on a wider level where we invite the grandparents and aunts and uncles, if they want to listen to and learn about how the metabolism works, what is diet, what's a healthy diet, why physical activity is so important, and how your brain works from a motivational perspective. And so that's the information that we provide as a supplement to the individual things. And then we organised get-togethers once in a while where we go ice skating together, or we go walking or running or swimming, and we build a bit of a community around the kids in the intervention to show them that there are their contemporaries that are making changes, positive changes, and also to show them that they're not on their own. And so we try and approach them from various angles. And then we, of course, work with the school environment, which is the third leg of our program, where we have a system. We have the leg of the program that I'm just describing is based on HEPS, which is a program called Health, Education and Physical Activity in Schools. It's a European program. We've taken the program and we've started implementing it into the schools that we're working with. And that's basically to work with the teachers to change the environment of the school to make it more of a healthy one. So the school teachers create a 2 or 3 year strategy, which it's written up and documented and agreed with us, and then it's implemented. So obviously the first thing, you change the access to perhaps the school shop or the assortment of things that you can get. You introduce water that children can drink rather than going and buying a fizzy drink. We work on perhaps things that can be introduced to make the physical educational activity lessons more attractive. So there are a number of areas we work on with the schools as well.
But you mentioned the changes as far as the school canteens are concerned. But recently parliamentarians have introduced an overall ban on junk food in school canteens. And the ban is to take effect in September this year. What are other things that you think that the decision makers could do to help reduce the risk of diabetes among children and teenagers?
Well, I think the best thing that they can do is to embrace the whole prevention aspect, because prevention is firstly cheaper than cure. It provides the individuals who would potentially develop one of, well, we're talking about diabetes, so diabetes type 2. So we would, so prevention would spare these people a lot of pain and suffering in their lives. It gives them better quality of life. They're more productive. There's a whole list of benefits why prevention is the way to go. So I would urge them to observe, learn, and take all the best practices out there and implement it.
So do you think that a nationwide screening would be a good idea?
Absolutely. Nationwide screening, education is very important. It's easy to say lifestyle, diet, activity, and awareness, but at the end of the day, there are so many excuses for not doing it. There's lack of knowledge, lack of awareness. You have to keep driving the message home. It's a long-term process, and it really has to be part of the educational system to keep us all healthy. And I'm really passionate about this because I think if I know how I can live healthily, I want to. I want my daughter, my child, to benefit from this knowledge, and then if my daughter and my child can benefit, then I'd like all the kids to really be healthy. It's essentially really important to look after your health. And I think the politicians and the policymakers should embrace this.
Mm-hmm. And coming back to the intervention program, talk about the outcome of the program so far, although it hasn't been completed yet. And are there any success stories that you'd like to share?
Yes. We will have hard medical data, I would say at the beginning of June, after the Polish Diabetes Association conference that will take place in May. However, I can just tell you from our observations and from our own personal data, we have around 50% of children who participate in the health coaching program are making positive changes in their lives. So we can see that they have their BMI levels are dropping. We can see that the makeup of their body, in other words, there's when we have special weighing machines which tells us how much water, fat and muscle there is in the body, and we can see how the fat is now being replaced by muscle because kids are being more active. We can also see that so just to conclude on that bit, we have 50% of participants that have changed, and then from a declarative perspective, we have around 72% of children who say that they feel better, they have more energy, they're changing their clothes to better fitting clothes. They have been told from their contemporaries and friends that they can see their changes in them, that there's something happening, and they say that they are generally feel a bit more confident. So these are all very positive indications that it's working, and on such a high percentage level, it's extremely encouraging, and it gives us a lot of hope that we're doing the right thing and we're on the right way.
Thank you very much, Marcin Radziwiłł, CEO of Medicover. Thanks so much.
Thank you very much for having us.